as the fourth most common cause of cancer-related fatality. In the US, colon cancer is a common and potentially fatal illness. Since it affects over 100,000 people annually, it is a serious health hazard. Sadly, colon cancer frequently does not show any symptoms until it has progressed, which is why early identification is so important. In this video, we will talk about the top 10 early indicators of colon cancer in this post, which everyone should be aware of. Acknowledging these signs can encourage people to get help, and possibly even save lives. 10. Anemia. Anemia, which is defined as a deficiency of hemoglobin or healthy red blood cells, has been linked to colon cancer. Colon cancer can cause bleeding in the intestines without causing blood to appear in the stool, which lowers red blood cell counts. You may have symptoms including exhaustion, dyspnea, and dizziness as a result. In particular, if these symptoms are present in conjunction with other warning indicators of colon cancer, it is imperative that you get additional medical attention from a physician. 9. Loss of appetite. Loss of appetite can result from colon cancer's disruption of your body's regular functions. Certain compounds released by cancer cells might change the way your body breaks down food, which can lead to a loss of appetite. Because of this lack of appetite, weight loss is a common symptom of colon cancer patients, and managing this symptom requires early detection. It is imperative to seek medical assistance as soon as possible due to the negative implications that malnutrition can have on general health. 8. Unexpected loss of weight. Inadvertent weight loss is a common indicator of several cancers, including colon cancer. People with colon cancer may lose weight due to chronic diarrhea or problems breaking down and absorbing nutrition. Interesting indication of unexplained weight loss is when it coexists with an appetite loss. For this reason, it is best to have a full assessment from a healthcare professional if you detect a noticeable and inexplicable drop in your body weight. 7. Nausea and vomiting. Vomiting and nausea may be signs of colon cancer. Substances released by cancer cells have the potential to interfere with your body's regular digestive functions. Furthermore, a rectal tumor may impede the intestines, leading to an accumulation of waste products and poisons. Constant nausea and vomiting may result from this. It is imperative that you seek medical assistance to rule out or diagnose colon cancer if you have these symptoms in addition to other warning signals. 6. Diarrhea. Although diarrhea is frequently an indication of a number of illnesses such as stomach infections and food poisoning, it can also be a precursor to colon cancer. More than 3 times a day, loose, watery feces are the hallmark of diarrhea. Consult a healthcare provider for a comprehensive assessment if diarrhea lasts for a long time, usually more than a few days, or if it is accompanied by other symptoms listed above. 5. Stomach pain. A common symptom of a wide range of medical disorders is abdominal pain. On the other hand, it might also be a precursor to colon cancer. Cancerous tumors can cause distension, cramping, bloating, and abdominal pain when they grow within the colon because they can clog the intestines and cause a buildup of gas and waste. Sometimes the pain could be so bad that you need to see a doctor right away. It is critical to see a healthcare professional for a comprehensive evaluation if you have severe or chronic stomach pain. 4. Prolonged tiredness. Another prevalent symptom among people with colon cancer and other cancers is chronic fatigue. 30% of patients with colorectal cancer develop chronic fatigue, accounting for around 80% of all cases of fatigue. Fatigue might result from malnutrition and weight loss brought on by colon cancer. Seeking medical advice is crucial if you experience strange and continuous weariness, since it might help identify the underlying cause. 3. Pelvic pain. Pelvic pain, while not a typical early warning symptom of colon cancer, may be a sign of a serious complication in those who have a history of digestive problems. Cancerous cells may have moved from the intestines to the pelvic area if there is pelvic pain. Although further investigation is necessary to show a direct correlation between pelvic pain and colon cancer, a population-based study has suggested a link between the two. As a result, Those who have a history of digestive problems should be especially aware of this symptom and should consult a doctor if they have pelvic pain. 2. Bloody stool. A bloody stool is one of the most prevalent early warning indicators of colon cancer. It may be a sign of bleeding in the rectum or lower intestine if you have maroon or darker colored bowel movements or observe bright red blood in your stool. Even while less significant issues like hemorrhoids or anal fissures can also result in blood in the stool, it is crucial to see a doctor to rule out any serious underlying reasons. In addition, people over 50 or those with a family history of colorectal cancer should get regular screenings. 1. Changes in bowel habits. Changes in bowel habits that persist over time may be a sign of colon cancer early on. Constipation, diarrhea, altered frequency of bowel movements, incomplete bowel movements, and variations in stool thickness are a few examples of these changes. While there are a number of reasons for these bowel movements, such as dietary changes or mild infections, it is best to speak with a healthcare provider to find out the underlying cause if the changes last longer than a few days. Early discovery of colon cancer can lead to much better treatment outcomes, so it is critical to recognize the warning signals. This article lists blood in the stool, altered bowel habits, anemia, appetite loss, unexplained weight loss, nausea and vomiting, diarrhea, abdominal discomfort, persistent lethargy, and pelvic pain as the top 10 warning indicators. It is important to keep in mind that several other disorders can also cause these symptoms, so having one or more of them does not always mean that colon cancer is the reason. If you found this video informative and helpful, please consider liking and subscribing to our channel. Your support allows us to continue creating valuable content like this to raise awareness about important health issues.